Hi, Dr. Rankin here at South Metro Wellness Clinic. Welcome back to our Tuesday filming here. As promised, today is part 3 of our lumbar spinal issues and how chiropractic treats the lumbar spine for pain and dysfunction. And today's video is designated to talk about and for patients who are experiencing pain across the belt line, which is extremely common. So we're going to back up here a couple steps and talk about our first two videos about our low back pain series here, how it starts in the thoracolumbar junction with dysfunction, goes into L3, which is the middle of the arc of life here. So I'm going to just go back here and specify this arc of life, which is when the curvature is appropriate, called a lordosis in our lumbar spine. And then the third piece here, which we're going to talk about today, the L5 or the sacroiliac joint dysfunction. Now, low back pain is a very, very vague term, okay? It could mean a lot of different things. So realistically, when we're looking at a case of lumbar spinal dysfunction or low back pain in a patient, it's important to look at all three pieces. So that's what our first two videos were specifically for. Low back pain does not necessarily mean sacroiliac dysfunction. It does not mean hip pain, which is the ball and socket joint right here. And it doesn't necessarily mean anything else going down the back of the glutes or the legs. So we're going to get into that in a little bit here. More specifically, just focusing on this portion right down here. We had two specific cases here this week of low back pain, both men under the age of 40. Okay, neither one of them had ever complained of back pain in the upper portion or in the middle portion. They were both affected at L5 and S1 right across the belt line and in both sides of their muscles. So specifically, what happens when a patient ends up with low back pain right across the belt line? Very indicative of long-term wear and tear, and also bending, twisting, and lifting, and then destroying this curvature right here. Okay, so when the lordosis gets really, really straight, all of the pressure that your body is carrying from the waist up, which is 2/3 of our body weight, as a reminder, all has to accumulate somewhere. What ends up happening is all of the pressure and stress goes down to the bottom. And if you can see this portion right here, indicative of a disc bulge, which is different than a herniation, different video for a different time. Okay, so we'll just stay focused here. Realistically, what ends up happening is all of the stress accumulates right here at the base, and the muscles that support your lumbar spine, the multifidus, the lumbar paraspinals, and the quadratus lumborum, have to work additionally hard to help keep up the amount of workload that your lumbar spine is designed to do. Once the integrity of your lumbar spine has been compromised, it's nearly impossible to get it back, especially after the age of 30. So we had to sit down in a report of findings and talk to these men about why their lumbar spines were completely dysfunctional, why they were having pain. One of them had pain for over a year. The other one specifically had a very, very severe sudden onset where both of the pillars were extremely damaged. What makes this tricky in the second patient's case, and was very, very difficult to explain to him, is that in any specific time when you are really destroying or damaging the curvature of a spine, yes, you can get it back, but the damage that ensues during that amount of time can sometimes no longer be completely retrievable. Okay, so with chiropractic care, on my honor here, once again, there is no cure. What we do is to help restore and reintroduce curvatures and appropriate functions so that you can live a higher quality of life. Without maintenance care, it will come back. So realistically, we have some possibilities of nerve damage and problems in the disc. And when a patient goes for a long period of time, you end up in a situation where you could take those bulges to a complete herniation, which is not a chiropractic case. So both cases this week for both of our patients, actually starting last week, were both severe cases for very different reasons. The tricky thing additionally is that when you change the function and structure of a lumbar spine at the TL junction, which is our first video, you don't always get symptoms. So you can technically have low back dysfunction without symptoms in the TL for a number of years. It can go down to L3 for a number of years. You'll have some insidious transient pain, might be a little bit here and there, just a twinge, while you're losing the structure of your spine and its integrity to bear weight appropriately. And then all of your pain will show up right at the belt line after it's been there for a number of years. So what I specialize in here is corrective care and looking at a person's posture, looking at all of the structures and all of the possibilities and things that go along with a lumbar case. Specifically with our first case and our first patient here last week, he didn't have a lot of dysfunction here in the TL. He had weakness. So his body was working appropriately, but there's possibility of nerve damage and there were some weaknesses there. And that tells me that whatever compromise had happened had been there for more than just 1 year. All of his symptoms accumulated in the lower aspect there, which is very, very common in men. What can also happen without having a lot of low back pain is you start to develop gluteal weakness because your biokinetic chain from the hip down to the rest of your lower extremity is no longer functioning optimally as well. Once again, anywhere along that kinetic chain, you can end up with dysfunction without necessarily symptoms. You can have symptom in a different different point and still have dysfunction in the rest of the leg, which is really unfortunate because pain is a fantastic universal motivator. It tells us what to do and what to get fixed, but it doesn't necessarily mean when you're looking at a whole conglomerate picture that that's the only issue going on. That's why corrective care is so important, and being adjusted from top to bottom is so important, starting with the neck of the occiput if necessary. So that concludes some of our education here, keeping it short and to the point about how low back pain is accumulated. If you need to take a review and a refresher of our other videos, we'll give you a little bit more information about nerve damage and decay in the discs as well. So we won't necessarily go over a ton of that stuff today. But realistically, what I wanted to hit on is why people end up with pain all the way across the belt line. It's very, very common in men. Typically, if you're a woman who is pregnant, is carrying, postpartum, your back pain is going to go away because the load comes off. You'll start to see if there was any damage that accrued about 4 to 6 months later, typically is what we see here. But those cases are completely different because it's still more of a short term, and that's not necessarily related to wear and tear. It is a temporary 3-month postural change, and those people do get most of their health back. God bless them after they're going through what they go through with raising children, which I've heard rumors about is not an easy job. So I wanted to also point out we do have some more affordable product options. I did receive a very helpful comment from our last video about the CBD. That particular level of CBD is one of our pricier items or pricier options. Not everybody right now is going to be willing to spend $80 to $90 on a jar of level 5. What we can do for people is bring in levels 1, 2, and 3, which are affordable options between $22 and $45 retail plus tax. Those are very effective options. Level 1 is lidocaine. Level 3 has menthol 4% and lidocaine as well. So those are some easier options. Also, some affordable options for every single person who gets into a car accident. Remember, massage is also included here along with your low back pain treatment for chiropractic care. A nice, comfortable hot pack or cold pack. Yep. This is fantastic, caliente or frio. So it's in Spanish as well. And the model is Spanish too. I didn't notice that. Just noticed that right now. Very, very bilingual option here. I love it. So this is a hot or a cold pack, and it's very, very comfortable. The one thing with these blue ones is be very careful. If you're going to get one of these and they're very affordable, wrap it, because the blue on the outside, that material there, if it gets any frost on it, it does decay very, very quickly, and then you'll lose your product and it won't be very good. When I purchase these, I give one to every single person who is in dire need, which is a gift to you, especially if you had a car accident. You have to ice. I recommend keeping it wrapped at all times. I actually keep, this is a reusable, resealable bag here too. You'll want to keep that, and that will help protect the product from getting, other food or any kind of moisture on it, because that does wreck it pretty quickly. Another very affordable option is our BioFreeze. So I've been using this like crazy on all of our patients here this week and last week because people are not able to attend as many visits, or they're spreading their wellness visits out. BioFreeze is a fantastic option. It's a topical pain reliever. This retails for $16, so that's even more affordable than the CBD, and it was a very popular product before our CBD came into the clinic, which was a very, very popular option everybody wanted. So what I do is to do the adjustments. If person is in pain, we just cool everything off with some colorless gel here. It smells like menthol, but there's no color, there's no grease. It's a very good product that's come a long way. So we do have these as another affordable option if you're unable to attend all of your visits, or visits right now as you're abiding by shelter in place and your visits are not emergency, or you're not working right now and you're finding care is unaffordable or more difficult difficult to afford, these are some affordable options for you, and I can have these ready if you would like to give us a call. Once again, 952-892-5006. Dr. Rankin here, signing off from South Metro Wellness, just wanting to extend you some comfort as much as we absolutely can during these times. Go ahead and give us a call if anything should come up. I'll be here waiting for you. Bye-bye.